Hi. You probably caught me off guard, didn't you? Welcome back to Friday Morning, for Good Living segment. And this is the segment that we talk about health. Every single thing in relation to health. We're bringing the necessary topics for discussion right here. And so I urge you to kindly get interactive with us on all our social media platforms. We are live on Facebook. It is Joy Prime without the TV. Don't add the TV, it's just Joy Prime. And when you get on there, don't forget to share the link. Let everybody know that we are on. We are about to discuss a very, very important topic. And not just that, our WhatsApp line is very active as well. The number is 055 157 5757. 055 157 5757. My name is Esia Duakumia, and this is Good Living segment on Prime Morning. Today we are talking about Ghana's immunization and recommended vaccinations for tropical countries. Ghana's immunization and recommended vaccinations for tropical countries. Ghana is a tropical country. And what is it exactly that you know about immunizations? What is it you know about vaccinations? Now, we want to specifically, we are going to start, it's going to be in stages. The conversation is going to be in stages. We are going to start from babies, we go to kids, we go to adolescents, and then we go to the adults, because they are necessary vaccinations for all the stages, throughout your entire life. There are certain vaccinations that you have to do to prevent certain diseases. But then what are the right ones for what? That's what we want to know. That's what we want to understand. What do they do? At what point in your life do you need certain vaccinations in your system? And so today I have seated with me Dr. Juan Fadul. Did I get that right?
Sure.
Fadul. So Doc is a medical doctor, tropical and infectious disease specialist, and she's with MMC Polyclinic.
Exactly.
Right? Okay, good morning.
Good morning.
How are you?
Very well, and you?
I'm doing great. And so viewers, please get interactive with us. Any questions at all that you have in relation to vaccinations, especially vaccinations in babies. If you're a mother, if you experienced, some vaccinations with your child that did not really sit right with you, that you didn't really understand, we want you to start sending in the questions, and Dr. Fadul here is going to answer every single one of them for you. Now, Doc, let's start with understanding what immunization is. And immunization, vaccination, are there differences or they are the same?
Okay, so this is a very important topic, because immunization, as you said, should reach out to every one of us.
Yes.
Should start with babies, but we should not also forget about ourselves.
Yes.
Why? Because we try to protect ourselves these days from everything. So we have a very important tool, which is the vaccines. The vaccines are injected in our bodies actually to stimulate our own immune system. So our own immune system will get in memory some antibodies that will reactivate whenever we are exposed to any disease. And like this, it will protect our body, making like a barrier for ourselves not to catch the diseases. Some diseases can be life-threatening, some diseases can be really serious. So by getting the vaccines, we are protecting ourselves, we are protecting our loved ones, we are protecting our babies from catching some of these severe diseases. And like this, we feel safer, and we can discuss all the recommended vaccinations from newborns to adults.
So what I'm thinking of right now is, okay, so as a new baby, they are now developing, their system and everything is now developing. So it's automatic that certain, should I say antibodies, or, the necessary things they would need to fight certain diseases wouldn't be there. So they would need the aid. But as an adult, is it that you would need vaccinations because you don't have the required things in your body to fight whatever diseases?
So, as an adult, of course, your immune system is more developed, is more mature.
Yes.
But there is some diseases that can happen at adult age. So, I'm talking here about the cervical cancer that a woman can develop. No babies or kids can develop cervical cancer, but more women and adolescent, even girls, can be exposed to cervical cancer. And here we have an important vaccine that is the HPV, the human papilloma virus, that can protect adult women and men, mostly women, from the cervical cancer happening in women. Okay. So every stage has its own diseases and its own vaccines.
So speaking about every stage, let's start with babies.
Sure.
Vaccinations that are necessary for newborn babies. What are they?
Exactly. So following the expanded program of immunization in Ghana, we protect our babies from different vaccines, different diseases, sorry. We start with the BCG, which is given at birth. It's for tuberculosis. Tuberculosis.
Okay.
It's a small vaccine that can be given in the left shoulder. It can leave a small scar, so sometimes
a whole lot of us have it. Yeah, I still have mine.
Exactly. So this is a protection, actually. It's a protection from tuberculosis.
Okay.
And it's given only one time, and then it's for life. So it's very efficient to give it because it will protect you for life, even with a small
the mark
that can stay. The other vaccines are a combination of vaccines given at 0, 6, 10, and 14 weeks. Diphtheria, tetanus, pertussis, which is the whooping cough, Haemophilus influenza type B, and hepatitis B.
Okay,
don't worry. Don't worry.
I want you to take your time.
Exactly.
Let's take it. Okay, so let's take our time and then take it one after the other. So from 0 to 6 weeks.
Yes.
And then
6, 10, and 14 weeks.
Okay, 6, 10, and 14 weeks.
3 dates, very important, because we give all the combination of the vaccines I just mentioned at 6, at 10, and at 14 weeks.
So let's go to those vaccinations, the names again.
Exactly. Diphtheria.
Diphtheria,
which is the D.
Okay.
T is the tetanus.
Okay.
P is the pertussis, or whooping cough.
Whooping cough.
Haemophilus influenza type B. Okay. It's a kind of influenza, like the colds that can happen.
Okay.
And hepatitis B.
Okay.
Then you have the pneumococcal vaccine, which is given for all respiratory diseases.
Okay.
Okay. Also same schedule. So these, if you want, are the recommended baby vaccinations when you go to check up on your babies the first year of life. Your healthcare provider will give you the necessary vaccines as DTP. The first,
because I'm actually wondering, is it that some hospitals end up not giving these necessary vaccinations to babies because we have, cases of hepatitis, we have cases of diphtheria, not in children though, but in adults.
Yes.
Tuberculosis.
So these vaccines need boosters at adult dose. Usually, most babies receive these vaccines. The EPI, the expanded program of immunization in Ghana, gives these vaccines to all babies. The tricky part is that you will need boosters. Usually parents remember to bring their babies when they are young to get their vaccines.
Yeah, and then
But then they forget that you need a booster at 4 to 5 years. You need a booster at 10 to 12 years. And then every 10 years you will need a booster, even adults. And this is why they rush to emergency whenever you have a cut. You will rush to emergency to get it cleaned or to do the stitches. And then they will ask you, when was the last time you received your tetanus vaccine? And then you call your mom because it's been a long time and you will not forget. And then we will remind you that you need a diphtheria tetanus vaccine. But the efficacy will last for 10 years.
Okay.
So it's a good time frame.
So even after, your baby taking all these necessary vaccines, they will need boosters as they grow older.
Yes. So the boosters is keeping in memory these antibodies in our immune system to defend our body from the diseases that we can encounter.
Oh, this is very interesting. So viewers, if you just joined in, this is Good Living Segments, and I'm seated with Dr. Juan Fadul, and today we are talking about Ghana's immunization and recommended vaccinations for tropical countries. That's the topic for discussions today on Good Living Segment. And if you have any questions at all in relation to vaccinations for babies, because that's where we've started the conversation from, please send in these questions. These are very, very important questions very important topics, because some parents tend to not be aware of certain vaccinations that are necessary for their kids.
Exactly.
So even if you go to hospital, you can't ask questions. So as a parent, when you go to hospital, what are some of the necessary questions you need to ask?
So first, I would recommend that you always get your book with you.
Okay.
So there is a vaccination book that you always need to keep with you, even for adults. I would recommend this because even after COVID, some universities, the international universities, are all asking about vaccination records. So please keep this book safely, as you will not remember all the dates when your child or yourself got your vaccination. So keep your book safely. And then the first thing is that follow up on the same book. and get your health practitioner always check your table, because it's your own table, the dates when you receive the vaccines, because sometimes it also depends on the brands. So whenever you receive a vaccine, we have to count 6 months or 2 years or 5 years for you to get the booster.
Okay.
So always check your own schedule and follow up accordingly for your booster time.
So not too long ago, I actually found out that there's a vaccine for chickenpox.
Exactly.
In kids. So when kids are injected with that vaccine, they don't get chickenpox.
Actually, they get, but at a much lower severity.
Oh.
So chickenpox is a virus, okay, that can spread easily, especially between kids. If it spreads to adults, it's even more severe.
Yeah.
So the first thing is to check your book, because if you already was exposed to chickenpox, you don't need to get the vaccine.
Okay.
Your body already have in memory the antibody to fight it, because it's a virus, and our body, if it's healthy, can fight it.
Okay.
So the first thing we check if you ever had chickenpox in your life. If not, then we can offer you the vaccine. Especially for adults who never had chickenpox in their life, it's very important for them to get vaccinated, because it can come more severe in adult stage. Then for the kids, it's starting 1 year of age. But this comes in the recommended vaccinations, not in the EPI program.
Okay.
So chickenpox can be given
For the sake of our viewers, what's the EPI program?
It's the Ghana Expanded Program of Immunization, the government of Ghana program. So it's starting 1 year of age. The booster can be given as soon as 6 months after, up to 4 to 6 years of age. So you get 2 doses of chickenpox, which is varicella vaccine, and then you're protected for life.
So it is true that once, as a human being, you ought to have chickenpox. Is that true?
True. If
it's
you
a must.
It's not a must, but any person can be exposed to chickenpox and can catch the chickenpox virus. Now, if you have the vaccines, instead of having pimples all over your face, your ears, the itching, you may have just a pimple here and there, just feel weak for 2-3 days, and then it will pass so smoothly.
Oh.
And this is the efficacy of the vaccine.
So this is when you take the vaccine. After you take the vaccine, it's not as serious as it would ordinarily be.
Exactly. So even if you're exposed to it, it will come really smooth.
Okay, so after, a baby, all these necessary vaccines are given to babies. Do they prevent, little minor mishaps like cough? Okay. A baby catching a cold?
Okay.
Does it prevent that?
Not necessarily. So vaccines are really targeting specific diseases.
Okay.
We mostly target life-threatening diseases. But simple colds, simple coughs are not really covered, because these viruses mutate. So every year we have new kinds of coughing, of viruses, of colds that can go around, okay? So the vaccines are not targeted to all kinds of viruses. But there is also 2 important diseases I would like to mention for babies, which are the MMR. What is MMR? It's measles, mumps, and rubella. Okay. It's very close to the chickenpox that we discussed, and this is given starting 9 months of age. And this is also very much recommended for all babies, because measles, mumps, and rubella also can come at any stage of life. Okay. The earlier we are protected, the earlier we get our vaccine, the smoother the disease, if we are exposed to, can pass easily to us.
Okay.
The second vaccine that is also in the EPI program is the yellow fever.
Right.
Okay. So anyone coming to Ghana, to any tropical country, needs to be vaccinated for yellow fever.
Yellow fever, yeah.
And why? Because some people think it's just a formality, it's just a book that you need to show that you have a yellow card vaccine. But you have to know that yellow fever is a disease where we don't have a treatment. We just have a vaccine. So if anyone is exposed to yellow fever, there is no real treatment for it. It's just hydration and supportive treatment, and it can be life-threatening. But we have a vaccine. So we really recommend everyone starting 9 months of age to get the yellow fever vaccine. It's a lifelong protection, just one shot.
You get it once, and that's it.
And that's it. And it will protect you from a very severe virus where we don't have a treatment and we just have a vaccine.
So for an adult who is quite unsure of whether in his or her childhood or as a baby he got the yellow fever shots, or what can he do?
If it's been more than 10 years, and he doesn't have any record of it, of course we recommend it to get the vaccine.
So you can take it again?
It can be like a booster.
Okay, okay.
It can become like a booster in case it was given before.
Okay, now let's come to kids and adolescents, vaccinations for them.
Sure. So usually the first vaccines will be done by the 2nd year of life, okay? These DTP, MMR, yellow fever, chickenpox, all these. But then you have another stage that is the 4 to 5 years. The 4 to 5 years, it's been already 2 to 3 years when you're done with your vaccine. You just need a booster, okay? Because you're growing, and then you're not a baby, you're a child, okay? And then here you just need some few boosters. Also, it would depend on the date where the first ones were given. But we talk again about the DTP and about the MMR. The later stage is 10 to 12 years. So parents, please mark these days and remember to go and ask or check on your book for these days. And then it will be the 18 years. 18 years is mostly when they go to university. So when they go to university, 18 years, usually they check on their book and they review all the vaccines recommended.
Okay, so you were quite distracted by the vaccines that are listed on here. So, Doctor, if you can run us through.
Very interesting. Yes, sure. So we talked about the BCG, which is the vaccine for tuberculosis, giving only one time, starting from birth for life. Then the pentavalent is the 5-in-1 that we discussed, the diphtheria, tetanus, polio, Haemophilus, whooping cough. Then we have the oral polio vaccines. The oral polio is, again, the same, given at 0, 6, 10, and 14 weeks. Okay. The pneumococcal is the second vaccine that is related to respiratory diseases, also combined for babies 6, 10, and 14. Now the rotavirus has a vaccine, which is also a very easy oral drops. Why we give these vaccines? To prevent our babies from getting very severe diarrhea that can get them dehydrated, especially before the age of 5 years. You know, kids can be dehydrated very easily and very fast. So we give them the rota vaccine, which is only oral drops, to protect them from the rotavirus that can give them severe diarrhea. The cholera actually is a very old disease that had a vaccine called the oral cholera vaccine. After COVID, people were asking again to be vaccinated and protected from any disease that can pass by. So we are really happy that the cholera vaccine is back, and it's also a very easy and oral drops. So you get it one time to drink, and then you get it again after 2 weeks only, and then you're protected for life. You know, against cholera. Cholera comes from the water. We know our kids can swallow water from the pool, from the tap, or drink from a glass, you know, they find somewhere. So just 2 oral drops of cholera, 2 weeks apart, will protect you for life.
And in adults, the same
too,
thing?
Starting 1 year of age, up to adults.
I think that this would, end up reducing the cases of cholera, because almost every year there's a specific season for cholera in Ghana, and it's very alarming.
After rainy season, you know, the rain will come, invade our water, and then the water is distributed, everywhere.
So that's actually the reason that it's like after rainy season, that's why you hear a lot of cases of cholera.
Exactly.
Okay. Oh, how I wish we could get...
it's okay, we can continue. We don't need the tape.
Let's continue this. So we're talking about the vaccines in kids and adolescents.
I have also 2 important vaccines. Starting 9 months, babies can get the meningitis vaccines. And here it's very important to discuss the meningitis vaccines. Why? Because meningitis is a bacteria that can go up to the brain and can be really life-threatening. So meningitis have different types. So we have meningitis A, meningitis C, W, Y, 135. We have 135 types. So not all vaccines protect us from all types of meningitis. So always ask your doctor the type of meningitis vaccines you are getting. The newest one is the Menactra, that protects us from all kinds of meningitis viruses. And it protects you for 10 years. Just 1 shot in the thigh for babies, in the arm for adults, that will protect you for 10 years for all types of meningitis. And this is really important. The second one is typhoid. Typhoid also comes from food and from water, but it's only starting 2 years of age. You get only 1 shot, and the booster will be after 3 years. So it's 2 years, 5 years, and so on.
Okay, so after you take it, 3 years interval, you take the next one.
Exactly.
Okay.
So for adults, for example, you have to check your meningitis vaccines, because if it's been 10 years, you'll need a booster.
Okay.
You have to check your typhoid vaccine, because after 3 years, that can pass sometimes really quick, you will need a booster.
Okay, so before we get into adults, I want us to talk about side effects of all these vaccines.
Sure.
After babies taking them, what are some of the things that their bodies could possibly go through? Kids, adolescents, what are they?
Sure. So a lot of parents are worried about the side effects.
Okay.
But I want to reassure you that now studies and scientists are working all the time to improve the vaccines. And the newest types of vaccine really have very few side effects left, which can be a slight fever that can be treated very easily with paracetamol. It can be some pain or redness on the injection site. In the babies, it can be in the thigh. In the adults, it can be in the arm.
Yeah.
You can just apply some ice for a few hours and then it will go. And maybe some fatigue or redness for the babies for 2-3 days. For me, I always tell my patients that don't worry. This is a good sign. Why? Because it means that your body understood the vaccine. He is putting in memory the antibodies. He reacted to the protection we gave him, and he's putting
Then some of us had a different mentality to this, because we're thinking that the body is probably trying to reject whatever you've taken in.
Not at all, because actually we're giving you a slight dose of the disease. So when your body is doing fever and reacting to it and then overcoming it, it means he can fight it. Right?
Wow.
Because then it will pass. All these side effects will go easily after 2 days.
Yeah.
So it means that your body really understood the vaccine, put it in memory, you have the protection now, and then you can overcome a bigger real virus when you're exposed to.
So now, today, parents don't need to be alarmed, because the side effects is not as major as, they used to think, because of the recent vaccines that are coming into the system.
Exactly.
So maybe slight fatigue, slight redness, slight fever.
Yes.
Okay, and then that's it.
Of course, if it persists more than 48 hours, you have to contact your doctor, you have to go again for checkup. But it's really very rarely that it happens these days.
After taking these vaccines, are there any restrictions afterwards?
Not really. Of course, for adults, I ask them not to go for the gym, not to do extreme. Just continue living a healthy life. No food restrictions, no restriction whatsoever. You continue your healthy daily life.
So in babies, in kids, and adolescents, there are no restrictions pertaining to this
intake.
Now let's come to adults.
Yes.
Vaccinations for adults.
Yes. So adults, the most important will be always the yellow fever, because yellow fever is given one time for life. There's no treatment for it. Once you have your yellow fever done once, check, that's it.
Yeah.
No need for boosters. Then review your diphtheria, tetanus, polio. Why? Because any one of us can get a scratch. Any one of us can get a wound in the kitchen, falling at sport field. So, and then you have to rush and go for your tetanus shot. While as if you already have it and it's protecting you for 10 years, then you're safe. You just need to clean your wound, antiseptic, and that's it. You don't need to rush. In emergency.
So it's not every time that something catches you that you have to rush to the hospital
if you've
already taken the tetanus injection.
Exactly. You can be at the beach, you can be somewhere, enjoying, and then an emergency can happen.
So in Ghana, are there any vaccinations that are easily overlooked, like very important ones that maybe parents are not really privy to, parents are not really aware of?
I would say there may be some misconceptions in some areas maybe of Ghana about some new vaccines, like the HPV. The HPV is a human papilloma virus. There has been some maybe cultural beliefs or, as we said, misconceptions about these new vaccines. We know that the vaccines will not protect us 100%, but they will protect as much as they can, like we try to protect our kids as much as we can. And they will protect from some part of cancer. Like we hope one day we will be able to protect from all types of cancer. But at least why not? If they can protect from few types of cervical cancer, why not? As long as all the side effects has been really minor. Okay, there's no other side effects that has been scientifically proven.
Okay.
Okay, so even if we can protect our daughters from some types like 6, 11, 16, 18 types of HPV virus, why not? So this vaccine needs to be more available, more awareness should be given, maybe more educations to schools, to adolescents. In some areas also of Ghana, I think they will benefit much more from getting this vaccine.
Okay, all right, viewers. So it's Good Living segment time. If you just joined in, thank you for joining. And we are talking about Ghana's immunization and recommended vaccinations for tropical countries. You know, like I said earlier, you know that Ghana is a tropical country, and so there are very, very important vaccinations or immunizations that we need to be very much aware of. And Dr. Joanna Fadul here has mentioned a lot that after taking all the necessary vaccinations as a baby, as you grow older, what you need to be doing is to be taking the boosters. But how can you do that? You need to be tracking the book that you're giving at the beginning at the hospital. It's very important that you track the book that you are given and make sure that you're doing the right thing. And so viewers, if you have any questions at all in relation to immunizations, vaccinations, what are some of the, the myths that you've heard about in relation to this, Dr. Fadul here is going to answer it all for you. So please and please and please start sending in the questions. And the WhatsApp line is 055-157-5757. 055-157-5757. Okay, so Doc, in the absence of all these vaccinations, as an adult, when you end up experiencing these diseases or viruses, are they treatable? Okay. Earlier, you did mention yellow fever, which, nothing can be done about it. It will only be managed in your lifetime. What other diseases or viruses as an adult that cannot be treated or can be treated in the absence of the vaccinations?
Okay, so very tricky question because every disease is really different.
Okay.
And I would say not only the disease is different, it will depend on the way we deal with it.
Okay.
So first, if the diagnosis is made early, you have a better chance of getting a proper treatment and the treatment will work faster. The problem is that sometimes it takes time to diagnose a meningitis. If your child has fever, we will not go directly and tell you he has an infection in his brain, right? And he may go into coma and he needs intensive care. So it's not the first thing we think of, right? Because he was just playing outside football in the sun and you will not expect meningitis to happen. So it's very important to get the correct diagnosis. So don't wait too long before you consult your doctor. Do the appropriate test. Do the blood test necessary, do the radiology test recommended, and then to make sure what exactly is the disease is. Once you know what the disease is and you give the correct antibiotic, then it's treatable.
Okay.
Right? But the difficult part sometimes is that patients arrive late or the disease is already spread. So it's treatable, but of course with certain limits. Right, and sometimes even the bacteria becomes resistant. So not any antibiotics will work. So we start with oral antibiotics, then it doesn't work, then we have to pass to the IV, then we have to mix some antibiotics together to make it stronger because the time is kicking, the disease is spreading, and we need more treatment to overcome the disease.
Okay, so still on the same topic of in the absence of the vaccines, let's come to kids. So when some of these, they start experiencing some of these diseases or viruses in their bodies, what are some of the symptoms that their bodies could possibly go through? If you can mention a few of these diseases for us to run through the symptoms, I would be elated. Yeah.
Sure. Like the most common ones usually are digestive diseases.
Okay. So
if your child is a baby, having runny diarrhea, you have to go for stool tests with culture to rule out rotavirus. Right. If he's having fever with diarrhea, then it may be typhoid.
Okay.
Right. Then typhoid, we have some blood tests, rapid tests, even stool tests to rule out typhoid. Typhoid also is a bacteria. It's called salmonella.
Okay.
So the salmonella bacteria can be treated with antibiotics.
Okay.
And we have very simple antibiotics that can treat it very easily as long as it is detected on time.
Okay.
Right.
Okay.
Some other viruses are just viruses, so they don't really need antibiotics. Here I'm talking about the hepatitis. We have to mention also the hepatitis A, especially people who work with food. Okay.
Okay.
We recommend them to be vaccinated for hepatitis A because hepatitis A comes from food. Okay. Handling food, even sharing food. Okay. I'm talking about the people who offer food in schools in
like
big, large quantities.
Right,
You serve food.
serving.
Exactly. Thank you.
Okay.
So these people are much exposed. Okay, to hepatitis A. So hepatitis A is a virus that can come to your body and your body can fight it, okay, even if you don't have the vaccine. But it can stay for a month.
Okay.
Okay. Here where the vaccine helps reduce this months of suffering for you to get rid of the virus. So if you have the vaccine, it will come in a much lower, mild phase, and it will not take a month for you to recover. While your body alone can recover from hepatitis A, you will need support. Support from the hospital, from getting the correct painkillers, from getting the correct hydration sometimes to help your body, because you will go through a lot of fatigue. You know, your body will shut down at some stage. You'll need him to recover and go over the virus. So some diseases can be overcome with the body alone, but of course the virus will help it come in a mild way, and the treatment will help overcome it much faster.
So this is in all stages with what you've mentioned so far. In all stages, it doesn't matter if you're an adult or if you're an adolescent.
Yes. Why? Because your immunity also can vary. Of course, adults should have a better immunity than children.
Yes.
But with bad lifestyle, smoking, alcohol, let's not mention drugs, and all these, your immunity can be as low as a baby, right?
When you do all these,
if you're
smoking, drinking, drugs,
exactly,
if your immunity becomes low.
Can become low, yes. Okay. If you're taking already so many medicine, like if you have hypertension, diabetes, heart problems, you know, your heart is not functioning, the pump is not as new, as young as it used to be, so it cannot fight the diseases and overcome them very easily. So here, bear in mind, even adults can have very bad and severe viruses to overcome.
What are the most cases that you record in your hospital?
Actually, I would say all kinds of infections.
Okay.
People will think it's only malaria, but I would say it's really all kinds of infections. We are exposed to bronchitis, to pneumonia, to otitis, to tonsillitis, to gastroenteritis, to all kinds of infection other than malaria, which is a parasite, you know. So not only focus about the malaria, like some patients just go do the malaria test, it's negative, then we're fine. It can be meningitis, it can be hepatitis, right? It can be any other kind of infection. So please be careful. If the fever is staying more than 48 hours, do a full blood count, do a full checkup. It can be a simple left otitis media, right? That can be very easily treated with only antibiotic drops even. But it's not only malaria, it can be all kinds of infection.
I think, you know, you just need to pay attention to your body.
Exactly.
And then when you notice something that isn't usual to you, you just need to seek medical attention. And I think you would be good. So, Doc, earlier you mentioned malaria, and I know that there's now malaria vaccine. Let's talk about that.
Okay, sure. So malaria is a parasite, okay? It's called the Plasmodium. Falciparum is 80% of the types of parasites that is in Ghana. So 3 countries were chosen to have the first malaria vaccines, and Ghana is one of them.
Yeah.
It started in some areas of Ghana, not in Accra yet, but they have started the studies, and we are really happy that it reached stage 3 and stage 4 of the scientific improvement. So the vaccine is really showing efficacy and safety.
Oh.
because we have to look at both sides, not to have side effects and to have positive results and for people to get less malaria. Even if they are bitten by the mosquitoes that can provoke the malaria, they are showing resistance and they are not developing the disease, which is great news.
It's great.
Yes, sure. And the vaccine is being developed for children and adults, which is also great.
Okay.
Okay. Now, at this stage, we are waiting for the final confirmation for the vaccine to be available for all professionals.
Right.
Because now it's still maintained because, it takes years to follow up on the side effects, on the efficacy. They will not just say, like, next month you didn't get malaria, then you're fine. So they need months, but it's showing very, very positive results.
This is very exciting.
Yes.
It's very exciting to know. So that one would also be a one-time shot and then you're good? Or it has to be, after a little while you take the booster?
We are waiting for the WHO to confirm.
To confirm?
Yes, but I think it will be different for children than to adults. But we'll wait for the WHO, the World Health Organization, to confirm.
What do you believe are some of the things that parents, in relation to vaccinations and, immunizations, especially in babies and kids, what would you say, or maybe I know that you might have heard quite a number of stories and all that, what would you say are some of the misconceptions that a lot of parents have?
Exactly. So I would say that usually, especially new parents, they tend to listen to all the stories that happen. But I want to tell them that the world is evolving. The vaccines are evolving. If your grandmother at one time had a small issue with the vaccine, it's not the same vaccine that we are using. We have learned a lot. You remember during COVID, everybody was praying for a vaccine. So the scientists really worked hard to get the best vaccine, to improve the vaccine, to improve the side effects. And like I tell them, luckily for me and for the patient, that now everybody's fine.
Yes.
They don't have to call all night because of side effects. They are doing fine after the vaccines. Everyone is happy. The protection is better and higher, and the safety is better and higher. So we are really lucky that the brands are improving. The long-term efficacy of the vaccine. So before, the meningitis vaccine was only for 3 years, for example. Okay. Then it was for 5 years. Now it's for 10 years with one shot. You get one shot, you get 10 years protection.
It is improving.
It is.
Maybe at some point we'll end up getting to a point where when you take it one time, you don't have to take it ever again.
Possible.
Maybe.
Yes, let's hope so. You all know about yellow fever. Yeah. That yellow fever before was giving one time for 10 years. Now it's for life. So, it's a simple example that can show you that really vaccines are improving.
They are improving. Yes. So they need to stop being scared and listening or, paying attention to all these stories in relation to vaccinations. And just do the necessary things. Just do the right things. Okay, but I know that briefly, it's almost time for us to go. I know that you might have heard of all these herbs, that we also take as Africans, as Ghanaians. Sure. So, when you want to, you have malaria, I will not go and take these vaccines because especially the COVID, for instance, when it came to it, people were having diverse side effects in relation to it. Some were throwing up, some were feeling so dizzy, some were having headaches. It was like
everyone developed his own.
Which makes it scary.
Of course.
That I would rather go and organize my herbs, take it, than to go for that jab or to go for the vaccine.
Okay, I would always say that herbs can be beneficial because we all know that nature is beneficial for us. But you have to know when to use it and how to use it. Okay. When you are encountering a virus, your body immune system will overcome the virus. If you help it with good hydration, with good lifestyles, with good beneficial herbs, of course your body will be better, will improve, and the immune system will fight the virus. But this will happen anyway.
Okay.
Right. If you're overcoming a bacteria, a salmonella, a meningococcal, like a very bad bacteria, no herbs, no support, no
can help you out.
Can help you unless a miracle, But you really need the correct antibiotics and treatment. needed.
Okay, so viewers, I hope that you enjoyed this time with Dr. Joanna Fadul, and we'll be talking about Ghana's immunization and recommended vaccination for tropical countries. But we have a comment. Let's take this one. I have vaccinated against hepatitis B. It's over 10 years now. What do I do next? I'm Kwame from Kumasi. Okay. What can you do?
Hello, Kwame. So if it's been more than 10 years, I expect you're an adult by now.
Yes.
So for hepatitis B, the good thing is there is a blood test. So you can go for a blood test and check your level of immunity from hepatitis B. If your level of immunity drops down, then you can get the booster very easily, one shot. If it's still fine, then you will know the level and you will know maybe to recheck in 2 years, 5 years or more.
So it's as simple as that.
As simple as that.
That's all you have to do.
Any lab test can do it.
Dr. Joanne, thank you so much for being here. Before you go, what do you have to tell viewers? What do you want to share? What do you want to put out there?
First, thank you for discussing this important topic. I'm sure there is a lot of misconceptions and more education that needs to be done for all of us, for Ghana children, for adults even. As we say these days, we like to protect ourselves, our loved ones from everything. So please try to protect them for all the diseases that they can encounter with simple vaccines that are safe.
Yeah, simple vaccines that are safe. Okay, let's take a very last one.
Sure.
My baby did not get the first vaccine because I was at the recovery room and my mom wasn't around to take care of that. Please, what will happen to her and what am I supposed to do? She's now 2 years, 7 months.
Okay, sure. So yes.
The first vaccine.
Okay, the first vaccines, maybe she's talking about the BCG, which is the tuberculosis.
Okay.
Tuberculosis, for example, can still be given if the baby is less than 5 years. Also, there is a test, which is called the MAN2 test, that can be given in the arm. If the baby doesn't react to it, then she's fine and she can take the vaccine. It means she hasn't been exposed to tuberculosis yet, and she can receive the vaccine. The other vaccines, I would say, we can still give them, but at a different schedule.
Okay.
So it will not be 6 weeks, 10 weeks, and 14 weeks again, because she's already 2 years, 7 months.
Yes.
So she can still get the vaccines, but at a different schedule.
Okay, so it's not too late for this baby.
It's not too late.
It's not too late. No. So you can still get your baby vaccinated, okay? Sure. Oh, she didn't add her name, unfortunately. Okay, all right, so thank you so much for tuning in and joining us right here. During the Good Living segment, my guest today has been Dr. Joanna Fadul, medical doctor, tropical and infectious disease specialist at MMC Polyclinic. Where are you located, though?
It's in Jowlu.
Jowlu. Oh, okay. Yes. MMC Polyclinic.
Exactly.
Okay, all right. Doc, thank you so much for being here. Thank you for enlightening us on this topic. And viewers, I hope that you've learned a lot from Dr. Fadul as well. My name is Asiodua Akumia. There are great conversations coming your way, so make sure you stick and stay. We'll be right back.